All right. Welcome to the Unfazed, Unedited podcast, where we provide commentary on complicated topics in an uncomplicated format. I'm Dr. Shaunna Payne Gold, and I go by she, her, hers pronouns. And Dr. Lisa, we are well into 2025. And of course, we got a lot to talk about. So, how are you?
I'm doing okay. I don't know that I would say we are well into 2025. We are a couple of weeks into 2025.
But and my thing is, I always feel like it's almost like this kind of false start feeling where I think, oh, it's Happy New Year. And then I look up and it's like the 30th. Like the month
Right.
always seems to go fast for me for some reason
Mm-hmm.
for
Mm-hmm.
January. And so I'm like, yeah, it's once I hit like the fifth or sixth, then it's like, I mean, quickly downhill for the entire month. And I look
Downhill
up
from
and
there. Yeah.
yeah, it just seems to go in the blink of an eye, but that's all right. Get us out of this wake up in the dark and go get off work at dark. I mean, like it's still
Oh
always
yeah.
dark. So
Yep. Yep.
anyway, I'm looking
That is
forward to
true.
not being in the dark the majority of the time.
Mm-hmm.
So
Mm-hmm.
anywho.
Agreed. Agreed.
Yeah, yeah. So anyhow, well, let's get into our topics for today. First, our word of the week, which is logical fallacy. Logical fallacy. And we found that there's plenty of different types of logical fallacies, but let's just give a fundamental around what a logical fallacy is. And it's a flawed argument that may seem true or convincing, but actually leads to an unsupported conclusion. And so, all the time, depending on how our individual logic works for each one of us, we may individually commit these logical fallacies, whether it's unintentionally or intentionally, specifically. And so, I think the best way to connect it to some the conversations that we may be having in this episode is around this concept that we may float around a bit, especially in American culture, around moving the goalposts, right? That's one form of informal fallacy, meaning that you may set a standard and then it just kind of seems, oh, how interesting. This person met the standard seemingly with ease, so something must be off. So let me move the goalpost again. And then they do it again. And oh, well, no, wait a minute. No, it just seems to be a little bit too easy for them. Let me move the goalpost again. And it often dismisses the accomplishments, especially of underrepresented folks, women, groups that folks usually don't want to give credit for being excellent at whatever they're doing. So I'm thinking about this, Lisa, which we didn't talk about this specifically during the election season, but I have friends of mine from my hometown that are not exactly politically blue. They are very red. And how many times did I see or hear something that was a meme or a comment that said, oh, well, yeah, Kamala did this, but she must have done that to get there. Or, well, yeah, she did that, but that's really not enough because she needs to do this other thing as well. And it just constantly seemed to be this refrain that actually was, of course, very eerily parallel to what Hillary experienced, right, at that time. And so I thought this was a really important concept to bring up because I hope that it lands on us differently as we pay attention to who willingly gives credit to certain folks and unwillingly gives credit to other folks.
Mm-hmm.
It's happened to
Mm-hmm.
me personally. I don't know if it's happened to you personally, Lisa, but in hindsight, I'm like, yeah, they were willing to give credit pretty quickly to one person of a certain skin tone or gender, but not to me. Interesting. So I think once we lift up this definition, it may be hard for people to now unsee it if you're paying attention.
Yeah, I think that you're right. There's like tons of different ways of this happening under logical
Hmm.
fallacy, but it makes me, I think for me, as I think about this concept, is that the logic seems to make sense but it actually doesn't, right? Like if you actually scratch
Right.
below the surface, like this rule
Hmm.
applies to everyone equally. Logically, I would believe that to be the case, but
Hmm.
the
Hmm.
standards are actually different, and so the conclusion is not supported, right? The logic doesn't support the conclusion, and I
Hmm.
think what you're
Hmm.
what you're sharing is right on there, and is definitely applicable to what we're going to talk about today.
Exactly. So let's move into phase one. And again, Lisa and I have yet again another running joke that I know more about what's going on with CU Boulder and their football team than she knows, and she's closer. How many miles are you away from campus, Lisa? I mean, nowhere from campus?
Oh, like 25, 30 miles. Yeah. Not far.
Exactly. Exactly. But I can tell her what the guys had for snack at practice. I can tell her what routes they were. I mean, yeah, I've been tracking them for quite a few years now. But
Hmm.
what I think
Hmm.
is interesting is that if we really jump into the conversation around Coach Prime, Deion Sanders, and his CU Buffs, what I think is really interesting is now we're finally at the place where Deion has been in Boulder for a good 2 seasons, has practically turned the entire program around. Even, I mean, we could even go to ticket sales and, season tickets and so forth. I mean, we can get into the data points around all of this. And we knew that there was going to be some major critique when he was recruited and came on board in 2022, where it was just the assumption that this was just really good social media content and hype, not really of substance, right? And again, I felt like it was interesting because I'm looking at this dynamic of coach moving from Jackson State to CU Boulder. So obviously going from an HBCU to a predominantly white institution, bringing players, many of which, including his own son, that had played at Jackson State, and bringing them to, again, a PWI where there were lots of perfectly logical explanations why they would not be able to play at a certain level or a certain standard. And the data points just continue to prove those uh, commentators and folks with such a heavy critique, proving them wrong and peeling back the layer of this is what racism really does look like, Lisa, in my opinion, when there's always a reason why the best of the best of underrepresented groups still are not, quote unquote, worthy enough to have their accomplishments applauded or even acknowledged. I'm not even going to go to applauded yet, just acknowledged in general. Um, and Lisa, my brain is uh, surely a bit biased into the quarterback position, specifically one of Deion's sons, Shador, just won the Johnny Unitas Golden Arm Award for being the best quarterback in the country, but yet was told or was talked about as saying, yeah, he's great on at a HBCU level, as if the level of HBCU is so different from a PWI, as if, oh, he's great there, but he won't be great here. You're a big fish in a small pond, but let's see if you can be a big fish in a big pond. And they just keep proving them wrong, even though they keep moving the goalpost almost literally on this team. And so, Lisa, I know that I've been following all of this much more closely, but you know, when we think about this whole concept of just not giving credit where credit is due, I just feel like the Buffs are given a great example of how to continue to persevere, but continue to call out those folks that still are unwilling to name that moving of the goalpost, right? So
Hmm.
yeah, how do
Hmm.
you respond to all of this?
Well, I mean, I do not follow them at all. You are correct. And I have kind of given up my I have let go of my interest in American football, both, well, I was never really into it at the college level, but at the NFL because of its hypocrisy, violence against women, racism, lots of white people profiting. So this is not at all surprising to me, right? And you and I have talked offline over and over again about CU and why you support them given that you live in Maryland, which I think aside is kind of funny, but the what you're saying around this kind of systemic underestimation of a coach's and a player's skill if they originate at an HBCU just feels very representative of football, right? Football culture in the United States. Like, it just doesn't surprise me that that would be an assumption that is made. And when I did some research for this discussion, I was trying to find stuff online that would explicitly make that connection around the way that racism was playing into Deion's or Coach Sanders' capacity to turn this football team around, and I couldn't find anything, right? Which doesn't mean that it's not there. It just tells me that there's a lot of kind of thinly veiled critique, probably from a lot of white commentators, sports commentators, who are suggesting that he's not good enough, right? And when I was into football, I knew of Deion Sanders. Like, I was familiar with him because he was kind of active at the time that I was paying attention to the football. So I thought it was pretty cool that he was coming to Boulder, especially since they have been a pretty dismal team, it looks like, just looking at some of their stats over the last couple of decades. Like, they were pretty good in the 90s, but then really weren't. They've, like, any bowl game that they've gone to in the last 20 years, I think they've lost, right? So they were just a pretty pitiful team. So I thought it was pretty exciting to have this ex NFL player who's got such name recognition and is so high energy come and turn the team around, right? So that you, after being educated by you about how many people are undercutting both him and his son and other players that were coming from Jackson State, there's my, like, both my whiteness and my lack of football knowledge kind of operating at the same time there. But it doesn't, I'm just not surprised by what you're sharing here at all.
Yeah, yeah. So it's, I think it's interesting. I think, that other piece where this feigned concern about nepotism just makes me want to just vomit on a regular basis because, you know, walked onto campus at CU Boulder with, at the time, 4 of his 5 kids. His oldest son, who Deion Jr., who handles a lot of the social media for CU Boulder's football team and several individual players. So he has carte blanche to be anywhere at any time for any reason. So that's the oldest son. The next son, Shiloh, is safety, who probably will be drafted. The youngest son, Shador, which just won Johnny Unitas, and rumblings around whatever has come forward with the legacy of the Heisman, if you will. Also, his youngest daughter played at the time, but now she's gone to another school, but she played basketball at CU Boulder, and then the phenom, Travis Hunter, who plays both ways, who's also probably going to be highly drafted. And, it was like, oh, well, this nepotism that's going on. Well, here's my thought on that with the nepotism piece. We've seen it happen more often than not, obviously, in other white legacy families in American football. That's number one. But then the second piece to it is I'm not quite sure how Deion wouldn't have an influence on people. Like his presence, his involvement, his role affords him the ability to speak to people who seem as if they're high up on a org chart. He can talk to them because they are actually his friends. They are his colleagues. They are former players, former GMs, former front office people that he knows personally. And so, how do you then, like, it would take a concerted effort to box yourself off from interacting with people that Deion has spent his entire career interacting with. And so, I'm just not here for it. I mean, that's where I am with it. I'm not here for it. I think
Yeah, yeah.
if if they were a white family, it would not be this point of
Right.
contention or discussion. And if they are going up to these next echelons of American football, I think the goalposts will just continue to move and move and move. I mean, the whole family could be in the daggone Hall of Fame and somebody would still say, "Oh, but." Like there would always be this caveat to giving credit. And so that's what's
Mm-hmm.
unfortunate. And I can't say that I'm surprised either, but I similar to lots of things that we talk about on this podcast, I don't want my lack of surprise and predictability of whiteness and white supremacy to muzzle naming that it's really occurring.
Right.
Right? Like I don't want it to be like, oh well, we knew this was going to happen, so we don't even need to mention it. No, I'm gonna keep on mentioning it. I'm gonna
Mm-hmm.
keep on mentioning when it happens. I don't care if it sounds like a broken record, but I don't want our I don't want us to get too casual and comfortable with white supremacy just being all around us and us not saying anything because that's kind of the antithesis of what we do. Just not gonna do
Yeah.
it. Not surprised,
Yeah.
but still gonna name it.
I mean, it is promoting a family member is nepotism, right? The problem is that when a white family does it, it's not nepotism, or it's because that person that got promoted is so amazing and so phenomenal it makes total sense. But as soon as a family who is not white, not necessarily black but not white, does it, right? Irrespective of the
Hmm.
quality of the player, it
That's it.
becomes nepotism and bad, and you shouldn't have done that. That's unethical and that's immoral. And so that's the
Hmm.
double standard,
Hmm.
right? So you're either against nepotism for everyone or you are for it, right? Like there's not really like an in between. It's not like then there's something ethically dubious about you as a human if it's okay for white families to do it but it's not okay for black families to do it, right? Like
Hmm.
I
Hmm.
mean that's where white supremacy is operating with that particular point, right? And
Yes.
then
Yes. Yes.
the underestimation of those players' skills and whether or not
Hmm.
Deion had the capability to turn CU around, that's also white supremacy operating just in a different way, right? Because it's the racist assumption that you're not good enough. Um,
That's right.
because
That's
yeah,
right. Yep.
yeah,
Yep. Yep. Well, and that's the thing though. Uh, it gets tangled up, and I know we have to move forward, but it gets tangled up. What if your child is in fact the best in that role in the country? You can still have nepotism and
right, right.
qualification, right? And I think that becomes the challenge
Yes,
is that
absolutely.
with whiteness, it has been nepotism and lack of qualification for some that
Yes, yes, yes,
much
yes,
more
yes.
so in comparison to nepotism qualified and let's just ignore them and not give them credit whenever they accomplish something.
No, that's 100% right. Because as
Okay.
we talked
Okay.
about with Kamala Harris in the political realm and Hillary Clinton,
Yes. Yes.
they had to be like over qualified to the nth degree, and it's still not good enough, right? And
Mm-hmm.
so it's the
Mm-hmm.
same with Dion's children. It doesn't matter how good they are. Like racism and white supremacy don't care how good they are. It's that he's
Right.
providing a benefit to a family member, and that benefit is therefore not available to a white player. That's what it is. You're totally right, because there
Mm-hmm.
have been mediocre white players who have been drafted and promoted through family or other connections for
Right.
generations, right? And
Right. Exactly.
they're actually not that good, right? But
Right.
for Dion and his children or a like family, they
Mm-hmm.
have to be out of this world outstanding, and that still might not be good enough. Yes,
Exactly.
100%. Yeah.
Exactly. Exactly. That's right. That's right.
Yeah.
So, I'm going to continue to follow because I know that the boys are entering the draft this spring, or the young men rather, or will be entering the draft this spring. And so I'm interested to see where they go. Um, Dion has made it clear that, yeah, he will have conversations
Mm-hmm.
with people about what would be the best situation for his
Yeah.
boys.
And he
I'm
absolutely
like,
should. Yeah.
have your conversation. Exactly. Because here's the thing, white folks have been having those conversations from the
Yes.
beginning of time. They just
Because they've
might not
always been
admit it,
there.
but
Yeah.
it's the
They've
norm.
they've always been there, so those conversations are normal. But because Black people
Hmm.
or other underrepresented people have not been in those spaces, those conversations haven't been able to happen, right? Yeah,
Absolutely. Absolutely.
yeah.
That's right. That's right. So we'll keep watching. I'll keep sipping out
All
of my
right,
CU Boulder mug and we'll see what happens. So,
all
but
right.
Lisa, what's going on in phase two here?
All right, so phase two, a little bit of a left hand turn here, but we wanted to talk about healthcare. So, if you listeners may recall, in early December last year, um, the CEO of UnitedHealth Care was shot, was murdered in the street in New York City. And um, in addition to an outpouring of support and sympathy for his family, his partner and children who were left behind, there was also concurrently a social media storm related to the ways in which United Healthcare, which is an insurance company here in the US, has denied people's claims and gate kept healthcare so that tens, hundreds of thousands of people end up not getting the healthcare that they need or go into medical debt, have debt because of medical procedures. So I just, I mean, it's a few weeks after the murder, but I think this issue of U.S. healthcare and how problematic it is certainly salient because we're a few days away from the inauguration of the 47th president, and we know that in his first term, he tried to dismantle the Affordable Care Act, but thanks to Senator John McCain, that didn't happen. But Senator John McCain is not around anymore, and there have been talks about dismantling the Affordable Care Act again. And with the Republican majorities in both houses, although that's what they had last time and it didn't work, but we'll see. So, I think US healthcare is particularly precarious right now in terms of people's access to it. And so I just thought it would be worth touching base and thinking about it because I was born in a country with socialized medicine, right? And
Hmm.
Medicare and Medicaid are socialized medicine. We have that here. But from what I understand is those programs for a socialized medicine program are the most expensive in the
Hmm.
world, right? Comparably. And,
Yeah.
the UK's National Health Service isn't fantastic. It has struggled because conservative or kind of right leaning governments have cut for decades,
Hmm.
and so
Yeah.
it's horribly underfunded. Wait lists are huge, but I wouldn't have to worry about healthcare access if I was unemployed. I wouldn't be paying $500, $600, $700 a month so that I could then go to the doctors and pay a $25 copay for that visit, right? Um,
Hmm.
I
Hmm.
wouldn't be concerned about not being able to do chemo if I had cancer because it would be so unbelievably cost prohibitive if I didn't have insurance. Like that wouldn't be
Hmm.
a thing, right?
Oh
I'm
yeah. Oh
sure
yeah.
I'm sure there are horror stories in the UK about chemo and cancer treatment that I am unaware of,
Hmm.
but it's not going to it's not going to bankrupt people, right?
Right, right, right. Exactly, exactly. Well, and I, especially after I went out on my own, decided, okay, we're going to do this entrepreneurship piece full time. Even the jump, for example, Lisa, between uh, there's a couple of jumps. So if Shaunna is just getting insurance monthly, that's one thing. But then there's a small, tiny jump if you have one child. There's a huge jump if you have more than one child, whether it's two or 20. And so, given that, I knew that it was going to be costly, but at the same time, you know, when I look around at, for example, how many times have I seen a family that created a GoFundMe campaign to help cover medical costs because they knew they would not be able to either pay for it fully out of pocket, some of it just paying the portion that they owe after the very
Right.
limited insurance
Right.
they have, and they still need to fundraise. Time Magazine talked about that specifically around how many. So GoFundMe did not create its platform for the purposes of medical costs, but when they looked at the percentages of folks that were using it for fundraising for medical costs, it was a third of the accounts And on top of that, I still need to go look at that other stat, Lisa, around the amount of folks that actually do fundraising for
Mm-hmm.
funerals and final expenses that I've seen quite a
Right.
bit as well. And so, given that, um, the the very targeted murder of a insurance CEO, it to me, again, I always use this visual of it's one thing to strike a match anywhere. It's another thing to strike a match at a gas station, right? And
Right. Right.
the we've been striking the match of healthcare and how frustrated the majority of the country is about healthcare. We've been doing that for years. I mean, pre-Obama all the way through Obama, all of that. But this right here, murdering someone in cold blood in the street, um, very targeted. I actually did see the video, and it is chilling how very targeted it was, given that there was another person nearby. Yeah,
Mm.
my first thought after seeing that was this person is not just making a general statement. I now it may not be true, but we'll see. My first thought was this is a John Q situation, right? Lisa, you saw the movie John Q with
I
Denzel
haven't, but it
Washington.
did make me think of the movie because you've talked to me about it
Girl,
and said I need to
it's
see that
good.
movie.
You got to
Yeah.
see it, girl. You got to
Yeah.
see it. And I won't, give you the spoiler to it, but John Q was specifically about a father. Denzel Washington played the role, that had a ailing child, and you had, I'm sorry, what's Ellen's partner's name? Um,
Oh,
I
Portia
can't
de
remember her
Rossi.
name. Yes. So she played the hospital administrator that was cold and nasty about, no, we don't have some, funding sitting around, and everything that you're
Mm-hmm.
using here costs. And it was interesting to see how Denzel's character was all of us as Americans.
Right. Right.
And Portia's character was the wall that we continue to hit in regards to, yes, we
Mm-hmm.
know this cost, but who on the planet can afford it? Very few, right? And so it was a statement. And so when I saw that video, I'm thinking to myself, this might be a John Q situation where this person
Yeah.
has either lost someone or is losing someone, and this shit is real personal. Um, and it happens to have a ripple effect across the country and the healthcare community. But yeah, this is not a new venting about healthcare insurance. This is venting in a different way where some folks are responding with callousness, like, oh, well, yeah, he's dead and gone. Okay, what's for dinner? Let's keep it moving because
Yeah.
it truly has been a separation of feelings or a callousness. And I think that the callousness is like, well, he and his company hasn't cared about me and my family and how we can take care of ourselves. So why should we care whether he's here or not?
Right.
And
Yeah.
I'm not saying that's the humane thing to do. I'm just saying that they're keeping the same energy. You don't care about my family. I'm
Yeah.
not caring too much about yours. They're keeping the same energy.
That's a good way to put it, the same energy. And this, also happened on the heels, if you remember, because December now feels so long ago.
Hmm.
Anthem changed their policy,
Oh, yeah, 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 yeah. Hmm.
and they were basically going to put time caps on anesthesia. So, like, if you're under for a surgery, the
Incredible.
insurance company was only going to pay for a certain amount of time based on assessments that they made. About how long you should be under an anesthetic for this surgical procedure. And if you were under for longer or there was more additional anesthetic drugs or whatever that you would need, then they wouldn't cover it. And I guess there was public outrage about it, but the day after the UnitedHealth Care CEO was murdered, they retracted that policy and changed it. Because So they obviously were heavily influenced by that, but also, you had medical professionals and anesthesiologists coming out saying this is a medical decision. Like, we don't know what's going to go down in any kind of surgical procedure, and an insurance company should not be telling me that they are only going to pay for 25 minutes of being under, right? Like, they might need to be under for 90 minutes, and then what are they going to do? So I mean, and that's part of the problem, right? And the Kaiser Family Foundation, that I actually think now just goes by KFF, they're like a kind of nonpartisan, nonprofit research, health research organization, and they do health policy. In 2022, they did a study, and they found that 41% of people had some kind of medical or dental debt, right? 41% of Americans. It was a representative sample. It wasn't obviously every American that completed the survey, but the debt rates were higher for women, for Black people, for low income people, people who live in the South, people who are 30 to 49 years old, and people who are non-college graduates. So those categories of people had the highest percentage of medical or dental debt out of kind of all of the groups. And the states, if you remember, Medicaid, I can never remember this, but Medicaid, I think, was expanded through the Affordable Care Act, and states had to agree to do the expansion. And I think there were 12 states that chose not to do that. And they chose not to do that because it was a President Obama thing, and it was totally a political decision. Anyway, those states have the highest levels of medical debt. Like, there are more people in those states that have that debt because they didn't expand Medicaid, right? So it drops, like, as you get older, it actually drops off medical debt, because then you have these other insurance, the Medicaid stuff that kicks in. And it actually feels so nonsensical to me as someone who didn't grow up here and then have to worry about, is the Trump administration going to repeal the Affordable Care Act, and then I am going to be without health insurance. You are going to be without health insurance. And I have a friend whose partner sells private health insurance, so outside of the Affordable Care Act, so outside of the marketplace. And I said I wanted to make sure that mental health was covered. Like, I wanted to make sure there was coverage for that. And he's like, you won't get it. If that's something you want covered in private insurance, they won't cover you. You're going to have to go through the exchange.
Right.
So, and they won't,
Right.
and they don't have to cover pre-existing conditions outside of the Affordable Care
Mm-hmm.
Act, right? That whole kids on
Mm-hmm.
your insurance up to 26, that's not a thing. So
Right.
the number
Right.
of uninsured people is going to skyrocket if the Affordable Care Act goes away.
Oh yeah, absolutely. And for those of us, to be quite transparent, for those of us who have more than one mental health bill in the household, if it's yourself and your kids or whatever that's going on, that that is going to be extremely cost prohibitive, extremely. And so, yeah, it's going to be this impossible situation if that gets repealed. And so I hope people make enough of a clamor like they did with the anesthesia piece of things, because I think they were going to pass that at a couple of state levels that they kind of blocked it.
Mm-hmm. Yeah.
Oh, my hope is that they do similarly if they try to roll everything back here.
Yeah. I mean, I know we need to move on to phase three, but
Mhm.
what shocks me most is the lack of humanity in this belief that here's a logical fallacy. If you have
Mhm.
socialized medicine in a country, you are going to therefore descend into a communist state, right?
Right.
A does not equal B there, so that's a logical fallacy.
Right,
But
right.
the other, that you are so, that this country and many people in it are so individualistic that they do not feel like it is appropriate to have this communitarian approach where everyone
Hmm.
contributes to the healthcare pot, so that everyone can have access to healthcare.
That's
Like,
right. That's
I
right.
don't want to do that because I don't want to give my hard-earned money to people that don't work. They don't deserve healthcare, and I work from that mentality. That is what
Hmm.
just is so lacking in humanity for me, and it's so prevalent here. That
Oh yeah.
feeling is so prevalent.
Oh yeah, absolutely. I mean, we praise individualism here in some of the
Right.
best ways and some of the worst ways, to be honest with you. So, but we saw that
Yeah.
with we saw that with the pandemic and masking. So I'll leave
Yep,
that
we
right
did.
there. I'll leave that right
Yeah.
there. So, yep. Yep.
All right.
Oh, well, we always, I mean, we got to find some high notes for this podcast, like for real.
We do.
But let me get into three. Phase three. So here we go, y'all. My beloved state of Virginia. Let's talk about my beloved state of Virginia. And y'all know I say that kind of tongue in cheek because Virginia has some amazing characteristics and it also has some not so amazing characteristics. But 2025, the Virginia gubernatorial race is going to be a barn burning history maker, given that you have two women that will be on the ballot. So either which way you slice it, you're going to have a woman as the resulting governor. It will either be Lieutenant Governor Winsome Earl Sears, who's the Republican on the ticket, or Abigail Spanberger. Both have been kind of the front runners in the party. Um, and what I think is interesting is, again, this takes us all the way back into the history of whether it's Virginia or other states where um, the last woman that ran on I believe, the last woman that's run for Virginia governor was actually Mary Sue Terry back in 93. So she was attorney general at the time, lost to George Allen. And so, given that, and I remember that more distinctly because I was in high school at the time and we were, in political science and civics, we were doing that exercise of who are you going to vote for? And it wasn't the actual people running, but you might do Superman and Wonder Woman or, whatever it is, you would just choose something and that would teach you the electoral process. And so, what I think is fascinating about this particular election is that, again, Lisa, how many times do we have to remind people not to become numb to the history of the lack of women in leadership where there were plenty of qualifications and skills to go around, right? So,
Right, right.
think about all of us, including my beloved Maryland, who is very blue. And yeah, it's just a lot of women in leadership here, but we've never had a female governor here in Maryland. And so, given that, to think that if this election, well, with the election outcomes of Virginia, we'll be left with 17 states that still to this day have never had a female governor. California, Lisa, y'all are guilty over there in Colorado too. Florida, Georgia, Idaho, Illinois, Indiana, Minnesota, Mississippi, Missouri, Nevada, North Dakota, Pennsylvania, Tennessee, West Virginia, and Wisconsin. Given all of this, I gave you the list of folks. Lisa, I know it might be too soon because we've gone through the never ending general election here in the US supporting Kamala Harris. But what is it gonna take? We do not have a shortage of qualified women in this country. What is it going to take to get more women as heads of government, whether it's
Right.
stateside or otherwise? What is it going to take? And this kind of takes me back, Lisa, to one of the. It was one of the. Was it a podcast that you and I talked about in regard to having the plan and all the facts and your strategic plan all laid out for everybody to read this glossy PDF? That doesn't work for folks.
Mm,
What has been happening is the 45 approach to things has worked, which is you have this problem, I'm going to fix it. You don't need to know the details of how I'm going to fix it. I'm just going to promise you that I'm going to fix it. Vote for me.
yeah.
Most women that I know that are super, super, super savvy and smart don't function like that. They
Right.
function as, yes, I see the problem. I can give you down to the granular, I'm talking about blade of grass as to how I would approach this problem with my solutions. And now I think you should vote for me.
Mm-hmm.
And non-thinking people are not going to go through that process of thinking to vote for a Lisa Ingerfield or a Shauna Payne-Gold. They're not. They want to know, this is my problem. You understand my problem. You said you're going to fix it. Okay, great. Let's go.
Yeah. Yeah, and I think I was just reading a piece in the Atlantic today about how I forget the exact title, but it's something like "Mainstream Media is Dead" or something like that. But it was kind of it was a longer piece that tracked the history of where the term mainstream media came from and the ways in which um, we still think about mainstream media as kind of network TV channels, so your ABCs, your CBSs, or your Wall Street Journals, Washington Post, New York Times, that sort of thing. But really, mainstream media now is actually encompassing of podcasts and bloggers and substacks and all these other ways, right? But but the Democratic Party in particular has still considered those outlets to be fringe, right? To be not mainstream media versus thinking about them as mainstream media. And the other point of it was that all of those kind of non newspaper, network TV channels are doing what you're saying. They're not particularly concerned with filling in the space with information about how something is going to be done. It's just really appealing to, do you like me? Am I likable? Do I make you laugh? Right? And having fairly high level, not specific conversations about the nuts and bolts. And that is what consumers, voters want, right? So that's really interesting. And the other thing that you're making me think of is there's been a lot of attention since the election about boys and men and how they're being ignored, and the fact that they are not as successful in school and in college, and there are more women graduates from college than there are men, and that's different, right? And one of the podcasts I listened to, the host was like, well, this like men and boys kind of feeling left out and not feeling like their perspectives are being heard, and that they don't really know what to do, and they don't really feel like they have a place anymore because the way that we understand gender is shifting, right? And so that kind of male breadwinner is not really a thing. Isn't that more a product of men just never having to have a plan and never really being asked or expected to understand the nuts and bolts and to do things for themselves and to pivot and to problem solve and to understand the complexity of problems and not rely on the women in their life to do that? So girls and women have always had to do that, right? And so that account, in the host's perspective, that accounts for the fact that they are now excelling as these gender roles are shifting. They are just more adaptable because they've always had to be. And so really the issue isn't that men are being ignored, is that they have never been asked to or equipped with the skills to manage change. So that speaks to what you're saying around that. Because women are, yeah, like think about Elizabeth Warren when she ran for president. She's like, I have a 7-point plan for this and a 5-point plan for this, and let me give you my
Right.
policy paper on this. Which, isn't that what you want in your like number one leader, right? But no, apparently
No.
not.
No. Well, here's the thing. People may want it, but they don't want to process it. They don't want to have to think
Right,
about it. They
right,
just want the
right,
promise that you have a plan. What, like, you remember when this fool got up here talking about, I got a concept of a plan. That's what it makes me think of, is that people are
right,
saying,
right.
okay, you got a concept of a plan. Okay, as long as you promise that you're going to fix it, then I don't need to know that it's got 17 bullets and 1A, 2B, 17C. They don't want to know that level of detail. The only detail they want to know is that you promised to fix it. So they don't
Yeah,
want
yeah.
that. They don't want that. Um, but what I think is so fascinating though is that kind of leads into those life skill pieces of things where I I know I've had these conversations with my sons plenty of times
Mm-hmm,
where
mm-hmm.
I have taken the back seat to say, like, they would come to me and say something or ask for something or tell me something's wrong. And I'm like, oh, okay, what you gonna do about it?
Right.
And stop and think about what you're gonna do about it.
Mm-hmm.
And you see the wheels turning, and I'm thinking to myself, I refuse to create a problem for whoever their spouse may be in the future. Like I'm like,
Right.
how do I interrupt the cycle
Mm-hmm.
of over overwhelmed partners that don't get the support? Well, part of that is, so it's so ironic you bring this up because I was just looking at it again, wasting my life on TikTok or something. And it was that video where the wife had just come home from a major conference or something, and she walked in the door. And this was last month when, people were still putting up their holiday decorations and everything. She came home for a conference. The house, you could eat off the floor. It was so clean. Dinner was made. All the Christmas decorations were up. Everything was up in the house. And she's kind of, panning around the house. And she's like, isn't it interesting that I have a competent adult that lives in my house that did all this stuff without being told to do it, without being told
Mm-hmm.
how to do it, without being told where stuff is. He just did it.
Yeah.
And it was so profound because I'm thinking to myself, when the words competent adult is what strikes me, is that I'm thinking now about my own mantra of saying, 50% is how people behave and the other 50% is how we allow them to behave.
Mm.
I'm thinking about all the times in my professional life or otherwise where I allowed men to be or act dysfunctional because I wanted to either do it quicker, do it my way, do it right, or save the situation when I should have just let them figure that shit out.
Yeah, and so I think you translate that to women leaders, right? If that is our
Hello.
expectation of men, right? Not
Hello.
least
Yes.
sexism and misogyny, but we have these expectations that men don't need
Yeah,
to fill in the blanks. They just need to say what they say and then magically, magic, right?
that's right. That's right.
But for
That's right.
women, we have expectations because they've always been the ones carrying the load on their backs. And so
That's it.
even I mean, like Hillary Clinton was the most qualified
President in
candidate for
history.
president in history.
In
And it
history.
wasn't enough, right? Which goes back to our conversation about Deion Sanders, right,
Mm-hmm.
earlier. But like the
Mm-hmm.
same, but like, and so and then she's beaten by the least qualified person in history. And he's a white dude and he has sound bites, right? He doesn't have any plans. He just has sound bites and people like that. Oh, he gets me. Does he though? Because he is a very wealthy person who's been bankrupt 5 times, doesn't really give two shits about the working class because
Mm-hmm.
he has treated them pretty badly. But okay, he gets you, sure, right? But how is he going
Right.
to? So that mass deportation, well, one, how is that going to happen? How much is it going to cost? And do you understand the kind of ripple effects of doing that,
Right.
right?
Right.
You know, and so I don't know. Like Ested Herndon, who is a New York Times journalist, he said that he hopes
Mm.
people don't walk away from that November election believing that a woman can never be president here because he doesn't think that that was what it's about. And I'm forgetting exactly
Oh, yeah, yeah, yeah.
what he was saying that it was about. And then but
Mm.
I just had a conversation with two women over the weekend and they were like, of course it was about sexism and misogyny, right? I think people say it was about the economy, but really it was about sexism and misogyny. So, and then that's what they believe. So they are feeling very dejected that there's not going to be a woman. So I don't have a good, I don't know. I don't have a good answer for you. Like I want to believe people are
Yeah.
better, but to your point,
No,
so
I don't. Mm-mm. They're not
yeah,
better. Nope. It goes back to the. I don't think people are better. I think people are tunnel vision about them and theirs without understanding the benefits of community.
right,
This
right,
country has never understood the benefits of community, whether
right.
it's talking about the earth, whether it's any of the eggs, whatever. We have not. I remember when I was sitting on the LGBT commission when I was still at the University of Maryland, and at that time they were about to vote for for same-sex marriage in Maryland, and we looked at a number of different points around the tax code and how even even a homophobic person should have voted for same-sex marriage, even for the tax benefit alone, because
Mm,
it's community tax, not individual tax. And you would get
interesting.
more with married couples than you would with those individuals not being married, but still being in relationship. So again, the community benefits, it's almost like a business case that Americans have been,
Right.
I don't want to use groomed is not the right word. I don't want to use that word anymore. Americans have not been
Primed, maybe?
primed or socialized. There it goes.
Socialized.
We haven't been socialized to think about the benefits of community. I don't think that's the
Right.
case.
Right. So then we make these individual choices on someone who is doesn't have community in mind, whereas and not all
Right.
women are great leaders, right? But
Of course. Right.
the
Right.
fact that we just have had so few of them is you're also like making a decision based on what? Based on like very little evidence to the contrary. But there's plenty of evidence that men are absolutely horrendous leaders, right? So I don't, yeah, I
Logical
mean,
fallacy. There you
right,
go.
right. So anyway, I don't, I, yeah, I think it just is frustrating. So Virginia, I mean,
Yeah.
That's great. So we'll be striking Virginia off that list of never having a female governor here in
Exactly.
2025. So
Exactly.
maybe Maryland and Colorado will get our shit together and we will have that too coming up.
I know. I know. Absolutely. We can only hope here. So,
Yeah.
oh, well, Lisa, we have had an incredible podcast here. Lots of things that are, uh, how can I say, they are certainly current event, yet still kind of evergreen in that I don't think we'll ever stop talking about moving the goalposts. I don't think we're ever going to stop talking about healthcare in this country. I don't think we're ever going to stop talking about women. I know you and I will never stop talking about women and gender, period. So, Lisa, let me tell folks where to find us. You can certainly find us on YouTube at Unfazed Unedited. Please subscribe, follow us at Apple Podcasts or Spotify if that's your choice. We're on Instagram at Unfazed Pod, as well as LinkedIn at Unfazed Pod. And you can always email us at info@unfazedpodcast.com. Or if you forget all of that, just jump over to our website, unfazedpodcast.com, where you can access all the new and old shows. And of course, please remember to like, subscribe, leave a review, share this with your friends, coworkers, or others in this phase of your life. So, Dr. Lisa, until next week.
Until next week, we'll have a new president.